You really get to make a difference, I think, in plastic surgery compared to some of the other specialties, and you see that difference right away. I'm Dr. Maelee Yang, and I'm a plastic surgeon here at the surgical clinic. I'm originally from Toledo, Ohio. I went to college at Case Western Reserve University in Cleveland, and then I went to medical school as well as business school at Ohio State University, where I got my MD and MBA. I then went to Chicago at Loyola University, where I did my plastic surgery integrated training, and then I decided to do an extra year in Michigan, where I did an aesthetics fellowship and also focused in breast surgery. I majored in both art studio as well as chemistry. Pursuing an art degree, you really have to have a lot of creativity as well as curiosity to try to learn new methods and techniques, and that same mirrored in plastic surgery. There's no specific or standardized approach to every patient, so you get to really tailor the treatment to the patient as well as the patient's wants, needs, and goals. Plastic surgery is kind of like a chess game. We're always given a problem, and you have to figure out what moves are going to make the best outcome for your patient. What order you do your surgery in, how you choose certain either implants or certain sutures. Everything is a move in that chess game to give your patient the best result. Something that my mentor used to always tell me is that the foundation to a good aesthetic or cosmetic surgeon is being a great reconstructive surgeon. So something that really drew me to plastic surgery as well is these long-term patient connections that you make. My breast cancer patients, I see them for years after their surgery just to follow them and monitor them. For me personally, breast cancer patients are one of the patient populations that I feel most connected to. My goal is to make these patients feel better coming out than they did going in. You don't choose to have breast cancer, but you get to choose how you get your reconstruction. And so those are patient interactions that are priceless to me and that really keep me going. As a medical student, there was one slogan that I always saw on the wall that really drew me to plastic surgery, and it was said, "Plastic surgery means to restore and make whole." And this is always in the back of my head whenever I meet a new patient. I want to restore them and make them whole both physically as well as emotionally. It's not just form, but also function. I want to make sure that it not only looks aesthetically pleasing, but it also works for you and is tailored to my patient's everyday life and needs. Growing up, my mom was an occupational therapist, and so I saw every day how she helped patients relearn how to walk, relearn how to use their hands. And so I know how important the recovery process is and making sure that we not only give you a great looking outcome, but also a functional one as well.